San Francisco Mayor Ed Lee wants to pump another $30 million into the city's homeless budget.
The critics are telling our filmateer all you have to do is look around to see that throwing more money at the problem won't really solve it, will it, Phil?
No, it's very interesting, and you don't have to look too far. As a matter of fact, we just took a walk down the main streets of San Francisco, and here's what we found. Broad daylight, downtown San Francisco, far from the tent encampments tucked under freeway overpasses and alleyways. We took a one-block walk in the heart of the city's tourist and shopping district. And after spending $280 million last year on homelessness, this is what we found. The beggars, the passed out. Where are you sleeping tonight?
My hotel room.
The walking ghosts, so mentally impaired that they barely know where they are. And some you may not even notice. Just down the street at Civic Center, addicts openly shoot up drugs outside the library as kids walk by. It's all too much for San Francisco Supervisor Jeff Sheehy.
People are feeling like things have been getting worse.
Do people feel like the city's spending the money wisely?
I don't think so.
Mayor Ed Lee, however, is calling for yet another $30 million to be spent for more shelters and 40 more psychiatric beds at San Francisco General Hospital, bringing the total homeless spending next year to $310 million. That's twice what the city spends on libraries and $90 million more than the city spent on parks and recreation. But Mayor Ed Lee knows it's going to take more than money.
They need facilities. Let's not do this false liberalism where you let people do what they want to do. Have judges and the criminal justice system change a little bit so that we can get people who can't make a decision.
Somebody's shooting up on the sidewalk and you're walking by and there's a cop there and that cop's not doing anything. That's the message.
We have to help people get in the right situations, and I'm never gonna call it a peer enforcement, but I will define it as our willingness to be compassionate and also help people make the right decision.
And what does that mean on the street?
When I've called for homeless outreach teams, they go up to folks, they say, can we offer you some services? They say no, and they walk away. People are still on the streets.
And therein lies the rub for any of these programs to really work. We treat homelessness in San Francisco as a health issue, a mental health issue. It's not a criminal issue to sleep on the sidewalks or otherwise break the laws. It's a health issue, and therefore it's up to the patient to decide if they need care. And Mayor Ed Lee wants to change that a bit. He wants to bring it into the justice system as well, take them to court and say, possibly, you need to be committed. That is going to be one of the biggest challenges he will face in his final 2 years of mayor if he goes ahead with it.